My dad was a furniture salesman. Growing up in the early 70s, girls didn't always think about going to medical school, and when I thought I wanted to take care of people and I thought I wanted to do different things in the health field, he basically said, well, who's in charge in the health field? And I said, well, I guess physicians are. And he said, well, that's what you should do then. And I honestly would never have crossed my mind. I didn't come from a family of physicians. He never went to college. My mom never went to college. But he was the one that I thought, well, I could do that. And so that's truly how it happened. I'm very lucky. I'm a girl that wakes up in the morning and likes to go to work. I like what I do, and I like taking care of patients. But after you take care of individual patients for 20 years, it's nice to kind of go 30,000 feet and think, how can you take care of a lot of people? So I think that as physicians, we really need to be spearheading things to keep our patients safe and not have other people telling us what to do. And there's a lot of places in medicine where we can do better if we're smart about it. And I think physicians hear it better from other physicians, and I think we owe it to our patients that we don't just think about taking care of individual patients, but realize we have to take care of everybody. Let's start with, if I'm on a labor and delivery unit at night and a nurse takes an order from me, and it's 3 in the morning, and if in the past, they would have just said, Dr. Puritz said to give this amount of medicine at this dose. We now do something as simple as reading it back so that the nurse repeats what you said. So that eliminates, you don't know that there's a problem until there's a problem. So simple things like reading it back, like double checking an armband twice. Those are some very basic patient safety, but they go a long way. Giving the right medication, having 2 people look at a medication if it's a high-risk medication. Those are some really basic safety issues. Chain of command, that if something doesn't feel right, physicians are often equated to pilots. And you all hear the story about the pilot that flew into the mountain that everybody saw because nobody wanted to question who is in command. So changing a culture that you can question something and it's okay, and you're not going to get yelled at, but you're going to be thanked for helping the team do a better job. It's a real culture change. It's a very fancy vocational training that we have, and we are taught to think about things on the level of a patient. And you're not going to affect change that we're talking about. You're going to do well for patients, but you're not going to affect change if you keep your focus on your 9:30 patient, your 9:15 patient, etc. You're going to affect change if you say, let me step back and fix the system a little bit. I think the way that people can get involved is whatever excites you and interests you the most. Try to align yourself with either that organization or the person in your hospital who's working on it, and just volunteer. There's always a need for somebody to step up to the plate. I think if you just model yourself after someone who's done it, it's very easy.